No, it's right on, right on. So, okay, we're going to shift gears a little bit, right? And one of the thing is the people who've been treated, they survived the melanoma, and inevitably, my patient find they want to know like what can they do both to protect themselves and also somewhat to give back to the community.
Sure.
And maybe you can talk a little bit about like what is a Skin Cancer Foundation? I know, there's you provide research grant and you provide public education, and you also validate sunscreen. And as you know, you and I work together as a part of the photobiology committee. And maybe talk a little bit about this skin cancer screening mobile service, right? Because you've done this for 15 years, you helped almost 25,000 people, right? And talk a little bit about that.
Sure. Well, I think to get started, our mission is to save and improve lives. And we say it's to save and improve lives because we know that, melanoma can certainly be deadly, right? We want to deal with it as quickly as we can because the odds are that if you deal with it earlier, you have usually a pretty good prognosis. But it's also to improve lives because it's not just life and death, right? There's disfigurement involved. There's all types of different things that are involved with skin cancer and melanoma in particular. So we're very careful to say save and improve lives.
Sure.
What we're trying to do with the way we do that is to empower people. We empower people to take a proactive approach to daily sun protection, to early detection, and then also the treatment of skin cancer. So there's kind of those three phases that we work on: prevention, early detection, treatment. If you can prevent it, that's number one, right? Do what you can to prevent skin cancer. Wear sunscreen, wear clothing, be in the shade, pay attention to what's going on out there and learn about how the sun damages your skin. And that's number one. If you're unfortunate enough to develop skin cancer, it's super important to catch it early, right? So that's where the early detection comes into place, whether it's you find it yourself and you go to a dermatologist, say there's something that I don't like, or you go to an annual screening and the dermatologist finds it. We want to catch it as early as we can. And along those lines, one of the things we always tell people, because it's very complicated on what to look for unless you're a trained dermatologist, we tell people to look for anything that's new, changing, or unusual, right? Any type of skin cancer, whether it's melanoma or non-melanoma skin cancer, all falls into one of those three categories. It's either going to be new, it's going to be changing, growing, bleeding, or it's unusual, which is kind of the catch-all for all of it. There's a lot of skin cancer stories we've heard about where people say they just didn't like something. Right? It didn't fit any particular category of an A, B, C, D, E of melanoma. They just didn't like it and they pursued it and they went to a dermatologist and it turned out to be something. So that's early detection. And then the treatment, right? And you said it earlier, it's about prompt treatment. The longer you wait, the worse things get. And there's almost never an instance where waiting is a good thing. So it's go get prompt treatment, learn things, get on the internet, understand, ask questions, look at brochures and articles, and understand what's happening so you have that peace of mind of knowing what your journey is going to look like. So prevention, early detection, treatment. Beyond that, the foundation has programs that fall into each of those categories. Okay, so a lot of what we do for prevention has to do with things like the seal of recommendation, which is what started our relationship. The seal of recommendation goes on sun protection products that meet certain criteria. They are reviewed by our photobiology committee, which, if anybody doesn't know, Dr. Wong is the chair of our photobiology committee and has been, for years and been involved with the foundation even longer than that. So the photobiology committee will review the data on this testing and decide if it meets the criteria. So that's the seal of recommendation. And we consider that an educational program because if you go into any store anywhere, you're going to see the seal of recommendation on sunscreens. And the idea is to remind people that the sunscreens are there to protect you, right? It's not to make you more tan or to tan in a nicer way. The sunscreen should be protecting you. So that's the seal of recommendation that has more than 100 different products, 100 different companies in there, maybe up to 1,000 products within those 100 companies. So it's vast, and that's been
I know. I reviewed them. I think I'm getting another batch from Stephanie soon. But go on, keep going.
For anybody that's watching, we owe Dr. Wong a big debt of gratitude.
No. Go on, keep going. Talk about some other programs. Yeah,
we're having fun. So if we move beyond prevention, right, and there's a lot of things beyond the seal. We always talk about the importance of reapplication of sunscreen, right? So putting on sunscreen isn't enough. You have to put on enough, and then you have to put it on multiple times throughout the day if you're out for long periods of time. There's so many different things we can talk about with prevention, just understanding how clothing works.